External rotation of the hip is important to prevent low back damage, SI joint damage, and also knee damage. So there's a few exercises that are really great for training external rotation into the hip. Okay, if you have a slick floor, I just use a pillowcase. And I'm in a quadruped position, so I'm just on my hands and knees. And I have my foot on a pillowcase, and I'm going to really put active pressure, and I'm going to just do a floor sweep. At first, you might do a few to just turn on your adductors, but as they're on isometrically, put more pressure with the adductors and the medial hamstrings down into the floor. Now this stretches the adductors and also helps to wake up the lateral hip rotators and strengthen them. So just do 10 to 12 of those and wake those muscles up. At the back, really engage the glutes. Get as much of a contraction there as you can. Okay, so that's one I like for isometric. Okay, the next one that I like is a 90-90 position. And again, you want 90 in front, 90 out to the side, and you want a basically straight line from the bottom of the foot through the knee to the heel of the back foot. Now, I do not have great external rotation in this leg. I have spent a decade really training internal rotation to stabilize my pubis symphysis, where I destroyed the cartilage there with my last baby. So this is something I need to work on. While you're in this position, it's the front leg we're focusing on here. You're going to pull, use the outside muscles, particularly the lateral hip rotators. You're really working to pull the front leg down to the floor. Super active focus. This is really great because it's helping the brain to map those muscles. Can I find them? Can I turn them on? And it's a really great way to help the brain map the muscles and to strengthen them. Then what I'm going to do is I'm going to really lean forward and add an extra contraction. I'm actually like engaging all of my core down to my toes even. Into external rotation. I'm engaging all of my muscles. Let's talk about my shoulders down away from my ears. Strengthen those. Really and then also pressure help to release the muscles that are really holding on too tight. Glute med, through my lateral hip rotators, to engage the muscles to pull my leg down to the floor and then come up. Now, just doing that 8 to 10 times, you're going to find your range increases. Now, when you have a lack of external rotation, you have really active adductors, you have really active fibers of glute med at the anterior side of those fibers, and TFL is really strong and overengaged. The problem is that pulls the femur to the front part of the hip capsule, and we really want it to sit in a more balanced way. So it's really important to make sure that the lateral hip rotators have equal strength so that they can balance out the femur where it sits into the hip socket. So just really working to be able to pull that front leg to the ground is super important. Another thing that I like to do is to try and pull that leg up. That turns those muscles on in a little bit different way, but you'll feel them. We want to be able to control the femur in external rotation. Okay, then of course do both sides. You will find that one side has better external rotation. My right side has way better external rotation. Again, really working to pull that down to the floor, really recruiting all the muscles to pull that leg down into external rotation. Okay, another thing that I like to do is if you're in a quadruped position, you have your hands on the floor, hands and knees, and if you put your foot on a yoga block, you're closer to end range of motion here in external rotation. And then you're just going to lift off the block. You won't get very far. That both stretches the adductors and engages all of these muscles in the posterior hip capsule to turn them on. So really focused, and you're just lifting off, hold, and then come down. It's a small movement, but it's really effective at tightening the back of the hip capsule up. Should be a little bit shaky. Okay, then of course do the other side and pay attention to the differences. I have way better control and range on this hip. I can hold it longer. I can feel it getting stronger. However, the lateral part of the vastus lateralis, you're going to find you have to strengthen that as well. Some people, that's their overactive muscle. But if you are lacking in ER, in external rotation, you may find you have to strengthen that. And this is a good way to turn that on. Another exercise is if you take a band and you come into a position, your hips are flexed, and it's a clamshell. So you're just going to stack your hips. You're not rotating back. This is not a spine exercise. This is all hips. So keep your hips stacked and just open and engage these muscles as far as the hip can go. It does not help us here if we lean back to get more range. Hips are stacked and we're just going as far as the hip can control, as this posterior hip capsule can control. We're using posterior parts of glute med. We're using a little bit of vastus lateralis, and we're using those lateral hip rotators to be able to control the hip in external rotation. And then switch sides. And you'll find that there is a discrepancy. And again, check yourself. Make sure that there's no spinal movement here. This is hips are stacked and it's all that lateral hip rotator, the lateral hamstrings, lateral quads, that they're doing all the work. No spine here. The last exercise that we're going to do for external rotation is an archer. It's a foundation training exercise. I really like it for the external rotation that it builds. So again, we're in a split stance. We're making sure our hips are square, which means you need to parallel the outside edge of the back foot. That looks like taking that heel and moving it a little closer to the wall than you may be aware of. So you're just looking for square hips. You're going to unlock both knees, and you're going to really grab the floor with all of the joints in all of the muscles in your front foot, and the back foot is up, the heel is up off the floor an inch. Okay, super stable. We're really working to ground into the floor. We're really anchored to the floor. Now, with this exercise, we're standing square. Our shoulders are over our hips. Our core is engaged. Bring both hands forward. You're going to use the opposite hand as forward foot. Put the thumb into the palm, and the hip is going to lead this motion. You're going to allow the back foot to pivot as you open up into external rotation on that front leg. You may feel your adductors here, and then the hip leads as you trace back. And you're just going to feel how that changes the length of the muscles on that front foot. All of the muscles of our feet are working here. Our core is engaged here. And we're really turning on lateral hip rotators, lengthening out adductors, and then switch sides. Allow the foot in the back to rotate with the movement, anchoring into that front foot. Feel how those muscles move. If you feel some creakiness, hopefully that smooths out as you go through about 10 to 12 reps. I really love that exercise for how it really works at making those muscles more dynamic, more adaptable as they change length and strengthen in a more balanced way. Give those exercises a try and see if you don't have a little bit better control of your external rotation.